Has your MRI report mentioned Syrinx or Syringomyelia? Are you experiencing symptoms such as numbness, tingling, weakness, pain, burning sensations, or changes in temperature sensation in your hands or legs? And are you wondering, can a Syrinx increase in size? Is treatment possible? Can symptoms improve? In this video, I will explain Syringomyelia in simple language and help you understand what your MRI findings may mean. What is Syringomyelia? Syringomyelia is a condition in which a fluid-filled cavity, called a syrinx, develops inside the spinal cord. A syrinx can occur in different parts of the spinal cord, commonly involving the cervical or thoracic region. When the syrinx affects the surrounding spinal cord tissue, it can cause different neurological symptoms. However, an important point to understand is that every patient is different. The symptoms, location, size, and progression of a syrinx can vary from person to person. Therefore, simply seeing the word syrinx on an MRI does not tell us the complete picture. What symptoms can occur with Syringomyelia? The symptoms depend on the location and extent of the syrinx. Some patients may experience numbness in the hands or legs, tingling or pins and needles sensations, burning or nerve-related pain, weakness, muscle wasting, changes in the ability to feel hot and cold, balance or walking difficulties. Some patients develop symptoms gradually, while others may have very few symptoms for a long period of time. That is why persistent or progressive symptoms should not be ignored. Why does a syrinx develop? Syringomyelia can be associated with several different conditions. These may include Chiari malformation, obstruction of normal spinal fluid flow, previous spinal cord injury, tumors, or other neurological or structural conditions. This is why treatment should not be decided simply by looking at the syrinx. It is important to understand, why did the syrinx develop? Where is it located? What is its size and extent? Is it affecting the spinal cord? And most importantly, is it changing over time? Why is MRI important? MRI is one of the most important investigations for evaluating Syringomyelia. However, one MRI report alone may not always tell us whether the condition is stable or progressing. In many cases, doctors compare previous and recent MRI scans to determine whether the syrinx is stable, increasing in size, or showing other changes. A neurological examination is also very important. If you develop progressive weakness, increasing numbness, difficulty walking, or new bladder or bowel-related neurological symptoms, timely medical evaluation is important. What is the treatment for Syringomyelia? Treatment depends on several factors, including the underlying cause, symptoms, MRI findings, size and location of the syrinx, and neurological status of the patient. Some patients may require regular clinical and MRI monitoring. If an underlying structural problem is identified, treatment of that problem may be considered, and in some situations neurosurgical treatment may be recommended. Patients may also require appropriate medical treatment, physiotherapy, rehabilitation, or symptom management depending on their individual condition. The important thing to remember is, there is no single treatment that is suitable for every patient with Syringomyelia. Therefore, you should not start or stop treatment based only on information found on the internet. If your MRI report mentions Syrinx or Syringomyelia, don't panic. Instead, get your MRI properly evaluated along with your symptoms and previous medical reports. The goal is to understand your condition, identify possible causes, assess whether the syrinx is stable or changing, and determine the most appropriate next step for you. If you or someone in your family has been diagnosed with Syringomyelia or syrinx, share this video with them. For more educational videos about spinal conditions, neurological symptoms, MRI findings, and holistic healthcare, like this video, subscribe to the channel, and stay connected. Thank you for watching.